Democrats involved, because we do allow a blue state to do a blue thing. That's states' rights. That if we had 25 Democrats and 40 Republicans, it wouldn't be a Republican plan. It wouldn't be a Democratic plan. It would be an American plan.
As long as we take repeal off the table, there are a lot of Democrats who want to bring a chair to the table. I'm one of them. Let's sit down together with Bill Cassidy, Susan Collins. I don't agree with their many aspects of their startup plan, but it's a good faith effort to do two things: reduce the cost of health insurance and expand the reach of health insurance. That should be our national goal.
What you see right there from Fox News Sunday is why I tell you that in Washington speak, bipartisan means Republicans rolling over to do what their leftist opponents in the Democrat Party and the leftists in the Washington press corps want to see done. There is so much there that it deserves our attention. Senator Cassidy, Bill Cassidy, MD, Republican senator from Louisiana, he has joined with Susan Collins, the moderate from Maine in the Republican Party, to come up with a health care plan that is totally unlike the bill that was passed by the House of Representatives. Mitch McConnell, the Senate Majority Leader, the Republican, has said, well, the Senate is going to have its own product, or playing the long game. Senate's going to have its own product. Dick Durbin, an incredibly partisan Democrat, at least for his purposes. Now, you'll notice he never said he'd endorse anything offered by Senators Cassidy and Collins, but it's a, quote, good faith effort. And the key to what Senator Durbin said was that, well, as long as repeal is off the table. So in other words, forget your promise to repeal Obamacare, Republicans. Even though the Democrats are in the minority, since they've got the press with them, never mind the folks at home. And I know this is going to carry no weight with the congressional delegation from Arizona, but it may in fact carry weight with the two Republican senators, or at least one of them. Don't forget John McCain. As we open this program, John McCain was in Australia bad-mouthing the President of the United States. So he'll always be happy to join in a, quote, bipartisan plan, even a plan that doesn't repeal Obamacare, that allows the Senate to set up some new discombobulation totally dissimilar to what the House has done, and then the Democrats have achieved their political goal. That goal, of course, is depriving the electorate, which voted Republican, from what the electorate wanted to see: repeal and replacement of Obamacare. Against that backdrop, we're pleased to welcome in health care law expert and the CEO of the Rotella Legal Group. He is an attorney. I don't hold that against him. Let's welcome Bryan Rotella back via Skype. Bryan, thanks very much for your time and welcome back to our program.
JD, thanks for having me, and I appreciate you not holding that against me. You know, I'm the lawyer who hates lawyers.
I know. See, that's my standard disclaimer. I'm not a lawyer, never played one on TV, but I was what they called a lawmaker, a legislator. And to that end, I know we've been advised never to concentrate on the legislative process because it's a bit like making sausage. But you heard the exchange, or you've certainly seen the product that Bill Cassidy and Susan Collins have put forth, and you hear the Democrats again defining bipartisanship as Republicans abandoning their goals to allow Democrats to continue their involvement of government in medicine. And there was Dick Durbin saying, well, if they'll back off repeal, maybe we can get something done. How dangerous is it for the Senate, in the current mindset, for establishment Republicans whether it is naivete or dislike of Donald Trump, how dangerous is this so-called bipartisanship in the United States Senate vis-a-vis the replacement of Obamacare?
It's as dangerous as you can get right now, JD, because look, what do folks consider to be essential? What's essential? Healthcare is essential to all of us. Most of your audience woke up this morning, they may have taken a Tylenol, a prescription medication. This is something that affects everybody. And the problem, and this is the problem at the core of American healthcare system today, and it's been the problem we've had for the last, I'd say, 20 years, and specifically with Obamacare. Somewhere along the line, the American electorate, or I wouldn't even say that, the American public got sold a line of goods that insurance for soup to nuts healthcare, meaning all of your healthcare needs, was the right thing and a sustainable thing for a country like the United States. Even though we don't use insurance that way for anything else in our lives. We don't do that with houses, whether we own them or rent them. We don't do it for our cars. And what concerns me, even though I thought that the American Health Care Act, as it got passed at the end by some support from the Freedom Caucus, with getting rid of or giving waivers to some of the issues like pre-existing conditions and also essential health care benefits, or one size fits all or baseline health care, were good things trying to get us back to an area where insurance was not the primary payer source for health care. My big concern is when you hear Senator Durbin, this thing's going to come out of the Senate, JD. It's going to be Obamacare light. That does nothing to move the dial on a true sustainable healthcare model for this country.
And let's talk about what the House passed. No piece of legislation is perfect, but the American Health Care Act, as passed through the House, has at least some features to commend it, to the point. My old friend in broadcasting, former talk show host and economist Jason Lewis, now a member of Congress, a Republican member of Congress from Minnesota, offered his view on why he was a yes vote, both in terms of pre-existing conditions and the current condition of the insurance market, to which you alluded, Bryan. Let's look and listen to Congressman Jason Lewis.
Well, this is the week that HHS put out a report that said under Obamacare from 2013 to last year, premiums more than doubled. They went up 105%. Under the Affordable Care Act, Laura, we priced everyone as though they were sick. Everybody had to buy on the government exchanges the most expensive plan possible. What happened was young and healthy people couldn't afford it. They dropped out of the insurance pools, and the insurance industry has a death spiral. Aetna and Humana say we're out of the Obamacare exchanges next year. So nobody's there to subsidize anybody else. By allowing the industry to price a policy that fits me best, a young and healthy person best, you get more young and healthy people back in the insurance pools to subsidize the sick. That's the only way to get this plan to work. That's the only way insurance can work.
Now, that last phrase, Bryan Rotella, the only way insurance can work. Does this typify really in both houses of Congress this emphasis on insurance and away from the marketplace and away from the notion that health care is a need but not necessarily a right? Certainly it's not guaranteed. Nowhere is it mentioned in our Constitution.
Absolutely, JD. It is a need, but it's not a right. As you pointed out, we just don't treat anything else in our country. Can you imagine if we went this way with our homeowners insurance, where I had to contact my homeowners association every time I had a little fault in the floor or my air conditioner filter was locked up? That would be insane. But we treat healthcare that way, whether it's through the government paying it with Medicaid and Medicare, or the VA, or with private insurance. What we really need to get back to, and what's really neat, and I want to break some news for your public here today, as I try to do whenever I'm on with you. There's some really cool models out there called concierge medicine and direct medicine. They're actually doctors that will pay them an annualized fee or a monthly fee. Guess what they'll do? They'll call you back on a Saturday and tell you what your test results were. They'll actually contact you the day after you see them to see how you're feeling. Why are they doing that? Because it's a cash transaction and you are their customer. There's not a third party in between negotiating everything. And just so you know, JD, I'm not against insurance, but I think when we start calling things, and I've heard Congresswoman Pelosi call catastrophic coverage or non-essential coverage death type of coverage, that's so wrong. We should be building what you and I'm going to date both of us, knew from the 1980s, which was major medical. Remember when we used to have the powertrain type of insurance for healthcare? So when something really bad happened, like it would happen with your car, we were prepared for it. We don't have that today. And that's what concerns me about what's in the Senate right now and what comes out. And it's why I think Lindsey Graham last week, Senator Graham hit it on the head. This thing may need to collapse until we get to a real repeal and replace that ultimately is something that the American consumer is going to say, you know what, my health care is better. My doctor likes treating me better. My doctor and I have a better relationship.
Well, as much as we would like to see a return to common sense health care, and as much as the market has been co-opted by government insistence on insurance and this mindset that coverage equates with care, which is not true. Yes, you've had the abandonment of various private insurers in states. And as I join you today from Arizona, where the average increase in premiums for Obamacare is in excess of 116%, this is untenable. But again, you have to view it through a political prism. The question becomes, and we hear talk that Rand Paul and Ted Cruz and Mike Lee are working basically to try and either come up with market reforms or say forget it. I think, which is what Lindsey Graham may have been referring to, although not naming the source. The question becomes politically. If Republicans kill any effort to get rid of Obamacare right now, they will sustain damage in the midterms, and though the damage may not be terminal to the Trump administration with an election, a presidential election, not until 2020, you may lose the majorities you campaigned on by not getting something done. Is there a political risk if they derail this replacement, whether it's Cassidy Collins or some sort of, quote, bipartisan cave-in to the Democrats?
There's absolutely a political risk, and you're right, JD. This is, I've never seen, you have to tip your hat. I give the Democrats credit. This has been such a, everything from the CBO's number that came out last week. Let me tell you, the folks at Disney can't do the type of fiction writing that number, 23 million uninsured, that they came up with. I mean, they even put in their report, if you read the report, I did, that it's a complete guess. They don't know what's going to happen. And of those 23 million in that CBO report, many of those folks they're assuming that there's folks that would get free insurance, would get Medicaid insurance, and that they would simply choose not to have Medicaid because it would mean they'd have to go through the process of signing up if there was not a personal or individual mandate. So the Democrats have gotten out ahead of this narrative. And this is where, candidly, I think that the House Republicans and quite the congressional Republicans in general have done a disservice to our president. President Trump is a salesperson. He has not been out on the front line with something that is driven to the American people where they say, gosh, that's a new idea that we can jump on. And the new idea that I really think he should be pushing, and which is in the American Health Care Act, is something called health savings accounts. And I'm not going to bore your audience and go through them right now. And that's part of the problem.
No, it's a great concept. It's a great concept. Catastrophic care and then tax-free accounts where you save and you can pay cash like you're talking about for health care. It returns what pollsters say we should never talk about, quote, market forces. But all that means if you're willing to pay, you get a cut rate. You become a consumer of health care. I'm on target. I agree with you, Bryan Rotella. I want you to come back. Let's talk about prospectively what this president should do. I think the president, he may not be a doctor, but he can be the salesman in chief, if not physician in chief. Get out in the country at large, sell his idea. The other thing I would suggest to the president is to call a special session of Congress to deal specifically with health care this summer. Don't let them take a month off in August into September. Bring them back and get the work done. Bryan Rotella, please join us again. Bryan is the guy who coined the phrase deadbeat dudes for the young guys who are able-bodied but not working, expecting you and me to pick up their health care costs. Bryan, we always appreciate your insight and analysis this morning via Skype. Come back and join us again. We'll make it a date and bring you back to talk about what needs to happen with health savings accounts. When we come back, a real easy rider who happens to be the Secretary of State. Stay tuned.